to the majority of people who could or you would recommend chemotherapy or mesothelioma patients, do they have the chemotherapy or do they say they're not going to have it?
Very rarely do patients not go for chemotherapy when it's offered. It does happen occasionally, but it's very unusual. If they're having targeted therapy as part of a clinical trial, you don't have to wait that long because targeted therapy doesn't affect all the organs. It's only affecting the cancer. So that's why it's going to be a really revolutionizing thing if it comes to pass that the targeted agents help mesothelioma, which it looks very good that it's going to. It's going to be great.
So you're optimistic about the treatment?
Yes. The targeted therapies is the newest chemotherapy because it limits affecting non-diseased tissue. So the side effects are very reasonable. And from the limited studies that have gone on at MD Anderson right now with the clinical trial of targeted therapy as induction, there's been some very good progress. And it looks very promising. And actually, MD Anderson is the only institution that's doing a targeted therapy induction trial for mesothelioma in the world.
Is there any pain caused through the chemotherapy given to mesothelioma patients?
It's not so much the chemotherapy that's causing the pain, it's the mesothelioma itself that's causing the pain. Some patients get the chemotherapy and the chemotherapy is altering the mesothelioma and then you can get some pain, but that does usually resolve. But mesothelioma in general does cause pain in the chest wall in most patients.
Would there be any way of the patient being able to manage that or dealing with it a lot easier?
Typically we offer narcotics and a pain specialist, physician usually can help get them over all that increase in pain.
But they're not given any like pain medication or anything?
Yes, we give them narcotics. Mm-hmm.
I have a question on the email. It's my understanding that you're from MD Anderson. How do I go about coming and being treated at MD Anderson?
Sure.
Is there any qualifications for being treated?
The easiest way to become a patient at MD Anderson is to go onto the website, mdanderson.org, and it's very user-friendly, and you can self-refer yourself. There's going to be a little caption, new patient, and you go into that, and you're going to come into the thoracic clinic, and you're going to come either into the medical oncology side, the surgery side, or the radiation side, any of those, and it's very easy. And actually, there's a telephone number on the website also if you don't want to go through signing up on the website.
Are there any other questions from any of you out there, either on the website or telephone lines or here in the room? If not, then I'd like to thank Vikki for her wonderful information today. And I would also like to invite everyone to our website to check on our upcoming lectures. We're going to continue this series following with surgical procedures and then by radiation, and a couple more we will talk about at a later date. Thank you, everybody.